بسم الله الرحمن الرحيم. أنا عارف إن الوقت متأخر وكل حضرتك تعبان وبينام, I will go thoroughly through my presentation, which is, I think it is more or less summation for the main outlines for the previous talks. I will talk about fertility reservation and overview. I will discuss the following items: definition, indication, targeted group, ways of reservation, advantages of fertility reservation, and the risk of fertility reservation. Fertility reservation is a type of procedure used to keep a person's ability to have children. Fertility reservation is the process of freezing eggs, sperms, embryos, or reproductive tissue so that the person can use them to hopefully have their own biological children in the future, often due to medical reasons like cancer treatment or non-medical reasons like delaying childbearing. The targeted group were including cancer patients prior to receiving gonadotoxic chemotherapy regimens and pelvic radiotherapy, before ovarian surgery for conditions such as benign and malignant tumors of the ovary and endometriosis. Low ovarian reserve, defined as an anti-Mullerian hormone level less than 1.5 nanogram per milliliter, regardless of the age. Family history of early menopause. Genetic factors like Turner syndrome with different gene mutations, systemic connective tissue disorders, systemic lupus erythematosus, and other autoimmune diseases requiring cytotoxic chemotherapy agents for immune suppression. Hematological system, hematopoietic stem cell transplantation, diseases requiring a high dose of chemotherapy and or radiation therapy for myeloblastomas such as thalassemia, sickle cell anemia, or Fanconi anemia. Social reasons, elective fertility reservation for women who postpone childbearing for various reasons. For transgender patients who wish to preserve fertility before transpositioning. In males, sperm cryopreservation is a highly effective method in adolescent and adult male. Testicular tissue cryopreservation, which is experimental, is the only available option for prepubertal males. Starting by the first thing, egg freezing. Egg freezing involves collection of women's eggs, freezing them and thawing them at a later date so they can be used in fertility treatment. Women essentially undergo the first half on the in vitro fertilization, which involves taking drugs to stimulate the ovaries and then undergoing procedure to collect the eggs. At this point, instead of fertilizing the egg with sperm, the eggs are frozen and stored in tanks of liquid nitrogen. This is the process of egg freezing. Ovarian stimulation, ovarian ovum become cryopreservation for limited storage. Ovarian tissue freezing is a fertility preservation option for women who are unable to freeze their eggs and for younger girls who haven't started ovulation. And it involves an operation to remove part of all of an ovary. The tissue is frozen, and when a pregnancy is desired, transplanted back into the body, usually back into the pelvis. Some women may then be able to get pregnant naturally, while others need or require the IVF. This is a picture showing the steps of ovarian tissue preservation. Sperm freezing is the most effective method of preserving men's fertility and can be stored for as young as 13 years if needed. You may want to consider sperm freezing if you have a condition or facing medical treatment for the condition that might affect your fertility. You are about to have a vasectomy and want sperm available in cases you can change your mind about having more children in the future. You have a low sperm count or quality of your sperm is deteriorating. You have difficulty producing a sperm sample on the day of fertility treatment. You are at risk of injury or death. You are a male transitioning to female, and you may want to preserve your fertility before you start the hormone therapy to have reconstructive surgery. IVF using frozen sperm is just as successful as IVF using fresh sperm, and there are no known risk factors from using frozen sperm in the treatment. Not all sperm survive, and freezing and thawing process. So before the sperm is stored, it is usually divided between a number of straws, which means that not all sperms need to be thawed at the once and can be used in multiple treatments. The standard storage period about 10 years. This is the process of sperm storing and taking testicular tissue. Testicular tissue freezing is a specialist technique to preserve the fertility of men who don't produce viable sperms in their ejaculate. When pregnancy is desired, sperm is obtained from the testicular tissue injected into eggs, so the woman needs to undergo ovarian stimulation and egg collection. The injected eggs are then intubated and any embryo transferred into the uterus between 2 and 6 days later on. Embryo freezing. Women undergoing treatment for conditions that may affect their fertility, for example, cancer, can freeze their eggs. But if they are in a relationship, at times they can freeze embryo instead of the eggs. Embryos are more likely to survive the freeze-thaw process than the eggs. Although most embryos survive in the freeze-thaw process, not all once thawed. Success rates are comparable to fresh embryos. Women essentially undergo the first half of an IVF cycle, which involves taking drugs to stimulate the ovaries and then undergoing an operation to collect the eggs. The eggs are then fertilized with sperm using standard IVF or eggs donating depending on the quality of the sperm. Once fertilized, the embryos are frozen in tanks of liquid nitrogen until you are ready to use them. Not all embryos are suitable for freezing, so only good quality embryos will be chosen to freeze. The standard storage period for embryos is usually 10 years, although in certain circumstances they can be extended for up to 55 years. Embryos are not affected by the length of time as they frozen. Advantages of fertility preservation. Oocyte cryopreservation, no sperm necessary at the time of retrieval can be used for fertilization. Clinically available, has to be carried out after puberty. Invasive procedure, clinically available. Embryo cryopreservation needs sperm at time of oocyte retrieval, has to be carried out after puberty. Invasive procedure can be carried out before and after puberty. Ovarian tissue preservation can be carried out before and after puberty, no sperm necessary, clinically available. Some of the procedures that provides use to collect eggs and sperms can cause bleeding or infection. In vitro fertilization may increase the risk of multiple births, premature delivery, low birth weight, miscarriage, and ectopic pregnancy. Laparoscopic procedure can cause infection, bleeding, and injury to nearby organs and tissues. Anesthesia used in these procedures can cause medication reaction, nerve damage, and postoperative delirium. Ovarian stimulation may cause elevated estrogen levels. This can increase your risk of blood clots and the growth of estrogen-dependent cancers. Ovarian stimulation can cause ovarian hyperstimulation syndrome. Ovarian transposition may result in rotation of the located ovaries. Ovarian cyst can be developed. Both conditions require ovary removal. Take-home message. Fertility preservation saves and protects your embryos, eggs, sperms, and reproductive tissue. This helps make it possible for you to have a child sometimes in the future. It is an option for adults and even some children of both sexes. Fertility preservation is common in people whose fertility is compromised due to health condition or diseases, medically indicated preservation, or when some wishes to delay having children. Personal reasons you may want to delay childbirth could involve finding the right partner, spouse, or waiting to wait until you're more established in your career. The main advantage is that you may still be able to have a biological child despite your condition or circumstances. Thank you.